everyone, welcome to HealthTube. Today we are discussing about hemophilia A and hemophilia B, two rare genetic bleeding disorder. Here is the main contents. We will cover the etiology, pathophysiology, clinical presentation, diagnostic methods, differential diagnosis, complications, treatment, prognosis, epidemiology, and public health consideration. What is hemophilia? Hemophilia A and B are rare genetic bleeding disorders that are caused mainly by the deficiency in clotting factors 8 and 9 respectively. These factors are essential for blood to clot properly. So people with hemophilia are at increased risk of bleeding. First, about the etiology. Hemophilia A and B are both inherited in an X-linked recessive manner. This means that a woman who is carrier of the hemophilia gene has a 50% chance of passing the gene on to her son. However, because men only have one X chromosomes, they will only be affected by hemophilia if they inherit the gene from their mother. About pathophysiology, clotting factors 8 and 9 are proteins that help blood to clot. When these proteins are deficient, blood clots more slowly, which can lead to excessive bleeding. The severity of hemophilia depends on the amount of clotting factors that is missing. People with severe hemophilia have very low level of clotting factors and are at increased risk of bleeding even from minor injuries. The clinical presentations. The symptoms of hemophilia A and B can vary depending on the severity of deficiency. People with severe hemophilia may experience bleeding after minor injuries such as paper cut or a fall. They may also bleed spontaneously or have prolonged bleeding after surgery or dental procedures. People with mild hemophilia may not have any symptoms until they are injured or have surgery. About the diagnostic method, the diagnosis of hemophilia A and B is made by measuring the level of clotting factors 8 and 9 in the blood. A blood test can also be used to look for genetic mutations that are associated with hemophilia. Differential diagnosis. Other conditions that are cause bleeding problems including von Willebrand disease, platelet disorder, and liver disease. Complications. People with hemophilia are at risk of a number of complications including internal bleeding, joint bleeding, muscle bleeding, blood clots, anemia, and death. Treatment and management. The treatment for hemophilia A and B involves replacing the missing clotting factor. This can be done with injection of clotting factor concentrate, which is made from donated blood. People with severe hemophilia may need to receive injection on a regular basis to prevent bleeding. There are also a number of other treatments that can be done to manage hemophilia including pain medication, antifibrinolytic drug, and surgery. Prognosis. The prognosis for people with hemophilia has improved significantly in recent years. With proper treatment, people with hemophilia can live normal, active lives. However, they can still be at risk of bleeding and they will need to be careful to avoid injuries. Epidemiology. Hemophilia A is more common than hemophilia B, with an estimated prevalence of 1 in 5,000 male births. Hemophilia B has an estimated prevalence of 1 in 30,000 male births. Public health considerations. There are a number of public health considerations related to hemophilia. This includes the need for blood donation to provide clotting factor concentrate, the need for education and awareness about hemophilia, the need for research to develop new treatments for hemophilia. With proper treatment and management, people with hemophilia can live normal, active lives. Thank you for watching. If you have any questions about hemophilia A and B, please leave a comment below.